Here. All right. Join now or forever hold your peace. And here we go. All right. So, everyone, welcome. Not fall 2024, but winter 2025. Here we go. Presented by the Predent Mentor Map and by students of dentistry. And I'll turn it over to Dr. Gallagher to give us some words to get us kicked off here.
What's going on, everyone? Thanks so much for coming out. Happy Wednesday. Happy trivia night. Dr. Roth, this is trivia night number 9. Did you realize that?
Trivia night number 9.
I
Yes.
love to, yeah, got to keep track of these because, yeah, we're 9 in. And thank you also, Sarah, for helping put this together. Because this is put together by the Students Dentistry team. Thank you so much for coming. I hope you enjoy it. Thank you, Dr. Roth, for hosting as well. The Freedom Mentor Map is our current, this is what we're trying to push. It's a free resource for pre-dental students to get live and updated data year to year on every dental school in the United States. We've began to add on Canada now. It gives you an opportunity to see, again, live stats and data for each dental school, to discuss certain topics on like a discussion board, much like Student Doctor Network, as well as connecting with current dental students from each of these schools, just to answer some maybe personal questions when you're applying to that school. So hope you like it. Let us know if you think there's anything we can make better on this while we still have our website team on the hook here to make it better for you and for others. We really want to expand this and make it something useful. So thank you so much for coming out. Thanks for listening to my spiel. And all right, Dr. Roth, let's do it.
All right. Let's get into it. The rules, if you're new to the game, is that there are 15 not just multiple choice questions. There's a few other types of questions in, but the results are relatively the same. So they're going to test your oral pathology skills, and time and accuracy are important here. So the quicker you answer, the more points you will get, but you have to answer correctly. So faster is more points as long as you get the correct answer. And there will be 20 seconds per question. So we do move pretty quickly here. And the theme of this season of trivia is syndrome. So every question will be syndrome related. Of course, be sure to follow us on social media so that you don't miss any future trivia nights, as well as all of the other cool stuff that we're doing, including Students of Dentistry and Predentor Map, but also the Dose of Dental podcast, where you can catch your trivia recaps, Top Dental Practices Elite Dentists, and of course, me both on Instagram and YouTube. So I always like to start off with the practice poll, which is which option best describes you, just so we know who's out there. Are you pre-dent, pre-med, other, dental, medical, professional student, a resident, or a practitioner? All right, so we have a lot of pre-dents and pre-meds or others, and then also some dental, medical, and professional students. So it's great. So hopefully everyone's got the gist of Kahoot and how it works, because we're going to get right on to question number 1. What syndrome manifests with the following radiographic finding below? And here is that radiograph. Is it squamous cell carcinoma syndrome, nevoid basal cell carcinoma syndrome, adenoid cystic carcinoma syndrome, or Cowden syndrome? So here we have a radiograph of a skull film, where, in case you couldn't tell, the falx cerebrae down the midline was calcified, which is a finding in nevoid basal cell carcinoma syndrome. So the calcified falx cerebrae, which is the dura that separates the hemispheres of the brain, is calcified in nevoid basal cell carcinoma syndrome. Speaking of nevoid basal cell carcinoma syndrome, that'll be a question number 2. But first, of course, we've got our scoreboard here. Oral Path rocks in second. I like that name there. But let's see. What is the eponymous name for nevoid basal cell carcinoma syndrome? Eponymous is named after a person. The person is pictured here. Is this Gorlin syndrome, Pinborg syndrome, Cutright syndrome, or Cowden syndrome? We usually try to avoid eponyms, but a lot of people know this. This syndrome by the eponymous name, which is Gorlin syndrome. Yep. Named after Robert Gorlin, who was very much a pioneer in oral pathology and genetics, defined a lot of genetic conditions, including nevoid basal cell carcinoma syndrome or Gorlin syndrome. And Lukpriyanamhin, I know I apologize for that. Maintains first place. Asham pulling into second. Always nipping at the heels there. Dr. Gallagher holds his bronze medal. Oral Path Rocks fallen down, but I'm pretty confident that Oral Path Rocks will make a comeback. And Dumb Sim has joined our leaderboard. But game's still early, so let's move on to question number 3. Of course, if you do want a review of nevoid basal cell carcinoma or Gorlin syndrome, be sure to check out my YouTube. I've got a full review of all of the signs and symptoms, not just the calcified falx cerebri. Question number 3. This radiographic image most likely belongs to a patient with which syndrome? Another radiograph. Is it Eagle syndrome, Hawk syndrome, Pelican syndrome, or Penguin syndrome? And the finding is this right here. It is an elongated stylohyoid process and calcified stylohyoid elongated styloid process and calcified stylohyoid tendon. The radiograph, or sorry, not tendon, but ligament. Radiographic is Eagle syndrome. All of the other ones were named after birds, but Eagle syndrome is calcified stylohyoid ligament, an elongated styloid process. It can make moving the head difficult and often occurs in the setting of trauma, especially tonsillectomy. Let's see how we did with our birds. Oh, Dr. Gallagher pulling into second. But we have 5 players with an answer streak of 3, which is great. That means that we're all getting the right answer. Question number 4, which of the following syndromes is named after a patient? Pinborg syndrome, Reiter syndrome, Gardner syndrome, or Cowden syndrome? This is unique because most of the time syndromes are named after the discovering clinician or scientific group, but this syndrome is named after a patient. That is Cowden syndrome, named after Rachel Cowden. Her family, it was discovered, had a long history of breast cancer and thyroid cancer, and someone put together that it was Cowden syndrome. And that was Dr. Gallagher has a streak with 4 in a row and pulls into first place. But our top 5 hasn't switched up very much. So maybe we'll see if we get a little bit of movement here. The game's still early. We're not even a third of the way through, but now we will be, because we're on to question number 5. Which of the following syndromes is classically considered a cancer predisposition syndrome? Again, classically considered a cancer predisposition syndrome. So Papillon-Lefebvre, Lagier-Hunziker, Lynch syndrome, or Leopard syndrome. One of these is really defined by predisposition to cancer. The other, not really, and that's Lynch syndrome. The other syndromes may or may not have cancers associated with them. It's very, very uncommon in the form of case reports and most likely a coincidence, whereas Lynch syndrome is really defined by at least one, if not multiple cancers in patients. And blue joins our leaderboard, but not a lot of movement, not a lot of movement. So maybe we'll shake it up here as the questions become a little bit more difficult. Speaking of Lynch syndrome, what cancer is associated with Lynch syndrome? Colorectal cancer, endometrial cancer, pancreatic cancer, or all of the above? Give a little hint last question. Colorectal, endometrial, pancreatic, or all of the above? All of the above, yes. So a lot of cancers are associated with Lynch syndrome. Yes, colorectal cancer is the most common, but Lynch syndrome is defined by malformation of mismatch repair genes and proteins, which their purpose is to correct DNA that has gone bad. When DNA goes bad, it can cause cancer, which is why patients with Lynch syndrome are really predisposed to a wide variety of cancers. Oh, lots of movement that time. We've got Asham in second, Oral Path joining our podium, and dumps him back in the running here. But we were switching things up a little bit into lucky number 7. President John F. Kennedy lived with which metabolic syndrome? Ignore the 7, should be a question mark. Was it cystinuria, phenylketonuria, Addison's disease, or Hashimoto's disease? Very famously had this metabolic syndrome, and they actually attribute it to why he may have become president. Addison syndrome. Addison syndrome can cause a pigmentation, not just of oral mucosa, but also of the skin, creating kind of a tanned or bronzed look. And a lot of people think that John F. Kennedy's natural tan, which made him look more attractive, was from his Addison's disease. And Dr. Gallagher looks like he was the only one on leaderboard that got that one right. But that means that there's lots of people nipping at the heels of our top 5 here. What is the etiology of Ramsay-Hunt syndrome? Is it a viral infection, a bacterial infection, autosomal dominant inheritance, or autosomal recessive inheritance? Ramsay-Hunt syndrome. It is a viral infection. Very good. It is a specific presentation of herpes zoster or shingles that is affecting the ear. So it can cause facial paralysis, it can cause hearing loss, and it can cause facial palsy. That's because it is attacking cranial nerves 7 and 8, and oftentimes we'll see the shingles in the patient's ear. So yes, Ramsay-Hunt is caused by viral infection. Wow, David Rose, higher answer streak of 3. Very good. Excellent. That means that you're probably nipping at our heels here. And I'm going to shorten it to Look. I hope that's okay. Look is back on the podium here. Let's see what we have in store. Which celebrity published their struggle with Ramsay-Hunt syndrome? Is it Tom Cruise, Justin Bieber, Selena Gomez, or Oprah Winfrey? One of these famously had Ramsay-Hunt syndrome about 2 years ago and shared their struggle on social media. And it was Justin Bieber. That's right. Justin Bieber was affected with Ramsay-Hunt syndrome and in fact had pretty marked facial palsy, luckily was able to recover. Richie is our highest climber, up 4 places, and Asham takes his place as the gold medal holder on our podium. And Dum Sim is now in 3rd, with Blue joining our top 5. So we've got lots of movement, lots of that pop culture question got some people. And of course, I did cover that with the silly little thumbnail on my YouTube channel. So be sure to check that out after the game here to learn more about Ramsay-Hunt syndrome. Question number 10, which of the following is a component of McCune-Albright syndrome? Monostatic fibrous dysplasia, Shea-Green patches, precocious puberty, or multiple osteomas? Only one of these is a part of McCune-Albright syndrome. Let's see how we did. It is precocious puberty. Now, for those of you that answered monostatic fibrous dysplasia, that patients do have fibrous dysplasia. However, it is polyastotic, which means more than one bone is involved. So not just one bone, but multiple bones will have fibrous dysplasia, which is actually what the photo mic was on the last slide. So a little bit tricky, but precocious puberty, which is early puberty, is a component of McCune-Albright syndrome. Oh, wow, Dumb Sim, our answer streak of 3. Look at that. Highest streak and gets on that podium in 2nd place, and Luck is back on the podium too in 3rd. We've got a battle all the way through. Lofgren syndrome is an acute form of what systemic condition? Tuberous sclerosis, systemic lupus erythematosus, sarcoidosis, or psoriatic arthritis? Lofgren syndrome. It is an acute form of a systemic condition, which is sarcoidosis. Yes, so sarcoidosis is, in its acute form, can present as Lofgren syndrome, which consists of facial nerve paralysis and bilateral lymphadenopathy as well, amongst others. But Lofgren syndrome is an acute form of sarcoid. Some hard questions tonight. Oh, Oral Path rocks back up in the top five, and blue takes third place on the podium. But look at this. It's a tight game. It's a tight game. So anyone can win here. We're coming into the home stretch with number 12. This radiographic image most likely belongs to a patient with which syndrome? Is it Gorlin syndrome, Gardner syndrome, Guillain-Barré syndrome, or Garfield syndrome? This is an actual CT reconstruction of a patient with this syndrome. And I'll give you a hint. These are multiple osteomas. All of these bony bumps are osteomas, which are seen in Gardner syndrome. Very good. Gardner syndrome, multiple osteomas. Wow, Oral Path rocks taking their place on the podium there. Select the histologic image associated with cherubism. So we have four pictures here, one of which is associated with cherubism. What we would see in a cherubism lesion, this is a really nice CT reconstruction of a patient with cherubism. We have four different images here. One of them is seen in cherubism. Very good. These are our chocolate chip cookies. Maybe you can appreciate that here and here and here. These are giant cell lesions seen in central giant cell granulomas and also the lesions of cherubism. This is a picture of an OOC or OKC. This is a picture of ameloblastoma, and this is a schwannoma. I think that's an OKC, but it looks like it might be orthokeratinized. It's a little bit hard to tell from that picture. But yeah, I think that's an OKC. But the giant cell lesion is the one associated with cherubism. And Annie has our highest streak of 3. Asham holds on to that lead, Luck pulling in second, and Dumsim in third. And we're coming down to our final questions. Patients with solitary median maxillary central incisor syndrome most likely have difficulty with which task? Walking, writing, breathing through their nose, or hearing high-pitched sounds. This is a picture with solitary median maxillary central incisor syndrome. It is something that can be seen at birth prior to eruption of teeth. And one of the most common findings at birth is difficulty breathing through the nose. There's constriction of the nasal passageways, leading to difficulty breathing. The others are not there. Asham with 3 in a row. Oral Path rocks just slowly pulling their way back, trying to get on that leaderboard here as we go into this last question. Asham has a commanding lead, but the second and third place is anyone's game. So Luck and Dumb Sim, hope you're ready, and everyone else, get ready. Maybe you'll take your place on the podium. But this is our final question, which is a slider question. As per the Canadian Cancer Society, approximately what percentage of cancers are caused by an inherited mutation? You have an option 0 to 100. Use your slider to best guess where the correct answer is. You will get points according to how close you are to the correct answer. So from 0 to 100%, what percentage are caused by an inherited mutation? Now, they give me a range, but I picked the average between the range. The range was 5 to 10%. So those of us that answered a little high, I don't know why it's going. Yeah, we need to go way down. There we go. So I put 7, but 5 to 10% is the correct answer. So those of you at the bottom, you have got that correct. But yeah, not very many are caused by an inherited mutation. So even though we talk about syndromes and cancer predisposition, according to the Canadian Cancer Society, only 5 to 10% are truly inherited. So before we get to the winners, thanks again for coming. Please follow us on Instagram for updates, and be sure to join us in spring, where we'll be back with 15 more questions. And let's take a look to see who our winners are. How about that? Brendan, any final words before we get into...
No, we're good. We're good. I'm surprised that it's so low because I mean, think about like BRCA genes and stuff. It's much higher to be predicting like, breast cancer and stuff or, whatever it may be. So I'm very surprised about that. Yeah.
Yeah, exactly. Exactly. But let's see who our winners are. In third place, we have Dumb Sim. In second place, we've got Luck. And in first place, I think we all know that that is Asham. Very good, everyone. Thank you. Someone said Oral Path rocks in the comments there. I'm guessing it's probably our fourth place winner, Oral Path rocks. But thank you all again for coming out. If you wouldn't mind, the top three, if you could send me a message in chat, private message in chat with your email, then we will be sure to make sure you get your gift cards. And everyone else, be sure to join us for our spring trivia coming soon. We'll
You
get a
want to
picture
set
of
a
our leading
tentative
board.
date while we're waiting? I'm looking at April 15-ish. 15th, 16th would be a Wednesday. Just tentatively, maybe the 16th.
Let's see. April 16th should be good.
Excellent. Excellent. Okay.
Tentative, everyone. So put that in your calendar. All right. I'm just waiting for Asham. If you wouldn't mind reminding me your email. Got it. Perfect. All right. I'm going to send this over. No problem. All right. Perfect. I'm going to send this over.
How's your week going so far, Steve?
So far, so good.